When you look at the number of cases that are increasing in certain U.S. states, but also in Beijing, what do they tell us about how this virus is changing?
Well, first they say that the virus is very persistent and, it's not that easy to get rid of. And that if you let your guard down, it will come back. And in the United States, there's no question that there are parts of the country that have let their guard down somewhat. That not just that they've opened, but that people have sort of mentally moved past, I think, the rigor that they need to follow in order to prevent infection. And the delay to see a rise is probably more like 6 weeks than 2 weeks. And so 6 weeks after the opening, we're starting to see surges in a number of states.
But Joshua, when you look at the difference between Beijing and the U.S., what's happening in Beijing? We understand there that actually social distancing is very much respected, that everyone wears a mask. So how do you deal with that? Is it a mutating virus, or is it just unlucky?
I don't think the virus is mutating so quickly that it's the main cause of what's going on. I think the virus is, persistent and people travel and then it can, like in this market in Beijing, it can start to spread again. China has, not hesitated to use some pretty aggressive powers to shut down the virus when it starts to move, things that we really wouldn't do in the United States. But even short of that in the United States, I think people have sort of psychologically moved on maybe in some areas, and that creates an even more fertile ground for spread. You really can't compare what's going on in the United States to Beijing. They have a few cases and they're jumping on them in Beijing. In the United States, we have thousands of cases and a lot of community transmission. And, we still haven't, in many areas, built the kind of public health response that's necessary to control it.
In the U.S., do you think there'll be a second lockdown, or at least taking more time in reopening certain states because of the number of infections?
Well, we're already seeing that. Utah, Oregon, and now Texas and New York are talking about that. I think it's, certain that as cases go up, people are going to have to do something about it. Now, whether they have to lock everything down again is going to depend a lot on whether or not we have a robust response capability, that will allow us to stay put for a little bit while the cases go down. And that requires contact tracing, isolation, quarantine, real work in public health. And, I think everyone who doesn't want to shut down should be asking, well, where's the public health response that we can count on?
Josh, talk to me a little bit about some of the evidence that we have on antibody treatment.
So the evidence is starting to accumulate that there may well be a real benefit from antibody treatment or convalescent serum, as it's known. There are studies, I believe, from the UK, from China, from the Middle East that are all suggesting a pretty significant benefit, including potentially mortality when it's used before people are very, very, very sick. So when people are sick but not critically ill and on a ventilator, that appears to be when there's a benefit. And that suggests there may be a benefit even earlier, perhaps, at the beginning of illness or even as a preventive treatment, which, of course, is how antibodies were used in the past. So there's still some major, very well-designed studies that are out there. But right now, it's, I think, considered quite promising.
There's a story on the Bloomberg terminal saying that actually the first COVID vaccines may not prevent you from getting the sickness, but it would prevent you from getting it very badly. Does that go to what we're seeing with antibody treatments?
It's possible. I mean, I saw some speculation. One reason we have so many cases still, but fewer deaths, may be that antibody treatment has been used a lot more in the United States than it was a couple months ago. Now, that's speculation, but it sort of speaks to the idea that, one outcome here is we could have some treatments like remdesivir, antibody treatment, and others that really do help prevent death.